All right, Joe Rogan podcast host Joe Rogan is positive for COVID, and he is taking like 7 different drugs and treatments, including ivermectin, a horse dewormer, and anti-parasitic in some doses for humans. Okay, all right, well, we'll talk about that. This is notable for a couple of different reasons. First, actually, maybe we'll look at the video clip first, but to set the stage. This is the same Joe Rogan, on whose show I've appeared twice, and he may never have me back on because I've been critical of the things he said about COVID and vaccines. This is the same Joe Rogan who said if you're healthy and you eat right like he does, you don't need to be vaccinated. Let's look at the video clip of Joe Rogan explaining what happened, listen to the list of medications and treatments that he's on, and then there's much to discuss here.
Hello, friends. So I got back from the road Saturday night, feeling very weary. I had a headache and I just felt run down. And just to be cautious, I separated from my family, slept in a different part of the house. And throughout the night, I got fevers and sweats, and I knew what was going on. So I got up in the morning, got tested, and turns out I got COVID. So we immediately threw the kitchen sink at it. All kinds of meds, monoclonal antibodies, ivermectin, Z-Pak, prednisone, everything. And I also got an NAD drip and a vitamin drip, and I did that 3 days in a row. And so here we are on Wednesday, and I feel great. I really only had one bad day. Sunday sucked, but Monday was better. Tuesday felt better than Monday, and today I feel good. I actually feel pretty fucking good. That's the good news. The bad news is we have to move the Friday show in Nashville.
Okay, so there's a bunch of stuff that is important to talk about here. Now, again, people have been, every time I talk about Joe Rogan and the vaccine stuff or whatever, people write to me to say, David, I thought you were friends with Joe. I've been on Joe's show twice. We've corresponded via Twitter a few times. I would say any of this to Joe. And this is not like some hot takedown. I'm going to tell you what I think kind of doesn't make sense about all of this. There's the macro and there's the micro. Okay. The big picture story from Rogan has been, this is not serious enough where young, healthy people should really go and get vaccinated. It doesn't make sense. What's interesting is way back when I was last on with Joe, he said he did think wearing masks outdoors made sense, even though I was kind of saying at the time, I'm not really sure about that. More recently with Bill Burr, he said masks outside. Are you wearing a mask outside? Sort of like that doesn't make sense. He talked about how this is not something that is serious enough that if you are not an at-risk individual, if you're healthy and eating right or whatever, you don't really need to be vaccinated. Now, that immediately raises the question, as a healthy person who eats right and stays fit, why then did Joe Rogan need 7 medications and treatments, or 5 or 6 medications and treatments, including things that aren't actually approved by the FDA either at all, outside of emergency use, or aren't approved by the FDA for COVID? That is, Joe Rogan's argument was no vaccine for a lot of people because the benefits don't outweigh the risks. COVID isn't that serious. Healthy people work out, eat right. But then you're throwing the kitchen sink at it. That doesn't really make sense. You don't need the vaccine if Rogan really didn't get it. I'm taking him at his word that he didn't get it. We hear about people who are secretly vaccinated. I have no reason to believe that Joe Rogan would do that. There are some right-wing hosts who we later found out are right-wing politicians. I believe Rogan hasn't gotten the vaccine, but then you're throwing the kitchen sink at it. And it's important also to understand, we're going to go through the medications. A lot of people wouldn't have access or wouldn't be able to afford all of this stuff either. So there are some people who were hearing this and they're saying, look, Rogan was right. He had one bad day. He's not vaccinated and now he's fine. Of course, that's to some degree chance, but also we'll talk about the NAD drips and vitamin drips and all these things, whether or not those things do anything. If you believe that they do, a lot of that stuff's not covered by insurance and the average person can't handle that. The vaccine is free. It's important to remember that. Now let's go to the micro, okay? So Rogan says he took monoclonal antibodies. That is only approved via emergency use authorization. It's available relatively widely, but remember that the Pfizer vaccine is fully approved by the FDA. And same as Moderna, which is only approved by emergency use for now, although in a couple of weeks it will likely be fully approved. The use of monoclonal antibodies is experimental in the same sense that they've been saying the vaccine is. So number one on the list is something that's only approved by EUA. So I'm not sure why someone would hesitate on the vaccine over lack of approval, but then go and take the monoclonal antibodies. That's a hypocrisy. I'm not saying it's Rogan's hypocrisy, but for people who are saying the antibodies are available, that's as experimental as all the vaccines were up until 10 days ago. And now Pfizer is actually approved to a more strict level. Now, then there's ivermectin. Ivermectin is a frequently used cattle medication. It is sometimes used in humans as well. There's no denying that in different doses. As of a few days ago, the big paper that a lot of people were pointing to say ivermectin works for COVID, it's based on Egyptian data, that was retracted. Why? They didn't have a proper placebo group. The Egyptian paper a lot of people point to was ivermectin versus hydroxychloroquine, not ivermectin versus placebo, the way you're supposed to do it in a double-blind randomized controlled trial. Then a group called the Cochrane Collaboration looked at all of the meta-analyses of the clinical trials on ivermectin. They found that a bunch of the individual studies had problems, just like the Egyptian one. And once you look at just the studies that are done correctly, they say there is very low to low certainty evidence that ivermectin is at all effective on COVID-19. Okay. World Health Organization, Infectious Disease Society of America, even the manufacturer of ivermectin, Merck, say there is no meaningful evidence for clinical efficacy in COVID-19 with ivermectin. Last week, the FDA started warning people, don't go and get ivermectin for COVID-19. And now the American Medical Association is asking doctors, do not give anybody ivermectin for COVID-19. So that's the second thing that Rogan is taking. Importantly, not approved, even under emergency use authorization for COVID. The Pfizer vaccine is fully approved. Lastly, real quick before we move on, how do people start trying ivermectin and stuff like hydroxychloroquine? The basics are, at the beginning of all this, when we didn't have a treatment, we didn't have vaccines, doctors in different parts of the world started trying cheap stuff that's just around. Hydroxychloroquine has been around a really long time and it's very cheap. Ivermectin is very, very cheap. So they start trying it. And if you have small cohorts of 20, 30 patients, and most people recover from COVID anyway, you're likely to get what is some apparent efficacy signal if you just have a bunch of random doctors saying, here, I'm going to give 30 of my patients ivermectin, or I'm going to give 30 of my patients hydroxychloroquine. By chance, you might get what appears to be an efficacy signal, and you're just throwing this stuff at it because it's cheap and available, but that's not how we actually do science. Okay, so that's ivermectin. Z-Pak, this is the antibiotic azithromycin. Now, you would say, why would you take an antibiotic for something that's a virus? And you would be right. There are some ideas that certain antibiotics could have an antiviral effect against some viruses. It's been studied with COVID and azithromycin. It doesn't appear to be the case. Study looked at a single dose of azithromycin, and it didn't change the proportion of COVID patients who were symptom-free versus symptomatic after 14 days. Now, you might say, well, David, why are they only getting one dose? Typically, azithromycin is given, as a course of treatment. Another study looked at intravenous azithromycin, 10 doses over 10 days. It also didn't statistically improve outcomes. Okay, so that's the third thing Rogan is taking. Fourth, prednisone. Prednisone is one of many steroids. And remember that there was the discussion of dexamethasone for COVID earlier in the pandemic. This is a very basic idea. This is the idea that steroids can mitigate the inflammatory response, and that inflammatory response can lead to lung injury in COVID. So you give the steroid, it reduces the inflammatory response in the lungs. Maybe it helps people recover. Maybe it helps people just feel better in the short run. That's generally connected to reality. If you have inflammation, you look at using a steroid, but unless you're actually having lung compromise, it's really not clear that it makes sense to take steroids. It can have nasty side effects. It can actually make you worse with some respiratory viruses. In previous outbreaks of novel coronavirus infections like MERS, the Middle East Respiratory Syndrome, or SARS, corticosteroid therapy sometimes actually extended how long people had the virus in their system. So it's really unclear. So that's kind of like a question mark. We don't know how involved Rogan's lungs were. It may have made sense to try throwing a steroid at it, or maybe not. The other stuff isn't really even medication. The NAD drip, that's nicotinamide adenine dinucleotide. It's very en vogue right now to do these drips. There's no indication it helps with COVID. Same thing with IV vitamins. It's very popular for wealthy folks to start getting these IV drips. I know people who do it. There's no reason to think that it helps with COVID. Now, then there's the final thing here. If this stuff works, okay, let's just imagine all this stuff works. COVID must be pretty freaking serious to throw all of this stuff at it. And what I mean by that is, if COVID weren't serious, if COVID were just the flu, then you wouldn't, if you were Joe Rogan, be taking monoclonal antibodies, ivermectin, antibiotics, steroids, vitamins, and an NAD IV 3 days in a row. That's pretty serious, right? Do you really want to take all that stuff, each with its own side effect risk, if COVID isn't that serious for someone who eats right or works out or is generally healthy? That's completely incongruous. And with the flu, you don't go and take 7 medications and treatments. So that's the real important takeaway here. I would love to talk to Rogan about this. He may have seen my last clips about him and decided I'm not having David Pakman on anymore. He may not even be aware of the clips. I have no idea, but I welcome the opportunity to talk to him about it. If you've been watching the show, you've probably heard me talk about how much I love my Helix mattress. Well, I was really excited to hear that Helix has launched a new company called Allform, which makes premium, customizable sofas and chairs with the same level of quality and comfort that I expect from these guys. And Allform is one of our sponsors today. They're giving you 20% off at allform.com/Pakman. They actually sent me a couch, which I put in my living room at home. It's now my favorite piece of furniture in the house. It took me just minutes to set it up. It's solidly built. It's huge. It's roomy. It has a modern, minimalist design, which I love, but it's also very comfortable. Fabric is soft, clearly very high quality. It has become the focal point of my living room. Their prices are very reasonable. And when you get a new sofa or chair, you get 100 days to decide if you want to keep it. And the best part is everything comes with a lifetime warranty. Stop buying poorly made furniture. Go to customize your own Allform sofa or chair right now and get 20% off your entire order when you get there by going to allform.com/Pakman. I've also put the link right underneath this video.